Once stigmatized, cosmetic procedures have soared in popularity in recent years, sparking booming demand for injectables and dermal fillers among South Africans seeking to enhance their looks. But there are a few keys, do's and don'ts to be aware of if you want to achieve the best looking results.
Aesthetic medicine is basically where we use non-invasive or minimally invasive techniques to create beauty and youthfulness in people's skin without needing to cut them open. So I think a lot of the times people confuse plastic surgery with aesthetic medicine, and cosmetic procedures could probably cover both of those things. Plastic surgery is when we need to take people to theater and then do surgery, things like liposuction or facelifts. Whereas aesthetics is more like dermal fillers, botulinum toxins, stimulating the skin with regenerative techniques such as platelet-rich plasma, or working on the body to treat stretch marks or loose or saggy skin, all of that without actually cutting people. So basically what we look at when we think about injectables is we look at something that bugs a patient. If someone says they're self-conscious about their nose or their eyes, then we can use fillers to rectify small problems in those areas. Or if we want enhanced lips or cheekbones or jawbones, that's where we would use things like dermal fillers. Botulinum toxin is more where we would use things into the frown. We would inject into the frown or the jowls or the neck, where we want to stop the downforce of those muscles. And if we can do that, we can actually create lifting in somebody's face. Even when somebody's 80 years old, that lifting can actually happen just by using injectables.
Owner of the Anti-Aging Art Medical Aesthetic and Holistic Wellness Center in Johannesburg, Dr. Reza, notes that in parallel to the growing popularity of cosmetic treatments, he has also seen an uptick in patients seeking to fix issues with their fillers and injectables.
Basically, we would look at you and we'd say, this is a problem. Say, for example, you had a car accident and there's damage to your bone and you can't really or don't want to have a surgery to rectify the loss of volume. We can use fillers to build up that tissue and we can make it look then symmetrical again. If somebody was burnt, we can use platelet-rich plasma in the acute phase, meaning, right away to heal the skin and help them with the abrasions or burns. If someone falls off their bicycle, scratches their face on the road, that's when we would use things to use the aesthetic medical tools to actually prevent scarring and to let them heal faster. But now when it comes to things like, old scarring, stretch marks, I had a baby and my tummy just never went back to where it was supposed to be. That's when we can use things to actually work on the skin and heal the collagen and elastin. It's about just looking at the holistic structure of somebody's face and skin and hair and stimulating what they need. It could be because something happened to them, like there was an injury, but it could also just be that they want to prevent the signs of aging from showing up or treat the ones that have already shown up. We want them to look like themselves, natural, healthy, and youthful. We don't want them to ever look like they've been worked on. And so I guess that's where the line is. When you've had too much, people can look at you and they can say, oh, I see you've done some cheek filler. Whereas if you've aimed for a really good looking, natural, beautiful result, nobody will know what you've done. They'll look at you and they'll think, oh, you look really nice. And that's kind of what we want.
Like any other form of surgery, cosmetic procedures need a medical practitioner trained in the procedure, including appropriate recovery time, healing, and proper care. Risks include excessive bleeding, infection, scarring, and failure to heal.
You can get a run into side effects. Even sometimes doing it perfectly, you can still get side effects. And that's something we want people to understand is there are a range of side effects that can occur with injectables. And obviously some of them are worse than others. Things like botulinum toxin, the effects could be short-lived. For example, if you had it done in your frown and you accidentally rubbed that area and it drifted onto your eyelid, then you could have a droopy eyelid for 3 weeks, which you could treat using eye drops. But if you were a little bit reckless with the filler, there are people who are injecting who should not be injecting. If they take that injection, push it into someone's face, push it at high pressure and high volume into an artery, you can actually fill that artery with a filler. And when it gets to the area where the artery split, it can then lead into the eye and create clots and you can go blind. You can even create strokes. Other than that, you can inject into arteries that cause ischemia. So what that means is you can kill the tissue around the nose, around the frown, The way we get around these or minimize these risks is to inject very superficially, very small amounts of filler. Even if it was in an artery, it wouldn't be shooting it upwards. You know, the blood flow in an artery is away from the source, which is the heart. And then we obviously avoid injecting in areas of the highest risk, such as the upper eyelids, the frown. But generally, you know, we look at how many patients we've been treating over the years, about 60,000 over the last 11 years, if we had to add up everyone. And really, there hasn't been a vascular issue here, which means no obstructions and no injections either into the vessels or excessively around the vessels in such a way that the swelling obstructs those vessels. So, careful attention to the technique, patient selection, the way we inject, the way we progressively work with filler. These are the things that we can use to reduce or minimize any risks of side effects. But people must be aware that, you know, you have to be discriminating about how you get your injections and your work done, because it can be quite a disaster if it gets done in the wrong way.
Aesthetics and cosmetic procedures take time. The best results come from consistent and gradual changes. To maintain a pleasing and natural appearance, treatment should target different layers of the skin over time.
The way these procedures work, it's not like surgery where you have it done and it lasts you 5 or 10 years. It's more like going to gym, but you don't need to go every day. Maintenance. We want people to work on themselves. If they're coming in every 2 or 3 months, we can work in different ways with different levels in the skin. Remember, we're not working with a single treatment. It's not that you need filler and then, you know, you come back for filler. You would probably use a mix of toxins, fillers, redermalization injections, platelet-rich plasma, chemical peels. That's the way you get a nice, natural, holistic look. You can't really achieve that using a single treatment method. And that's why we want people to look at it as a program, something that they will work on themselves on a gradual basis. There's a different age for surgeries, medical treatments, and it varies and it changes over time here in our country. But the thing is, we try to discourage people doing aesthetic procedures purely because they'll say, look, I don't like my nose, or I don't like my cheeks or my chin. If there is something wrong, so let's say they were born with an indentation in their face and they can't do anything about it and they don't want to go through the risk and cost of surgery, then we can work on it under the parents' consent. You know, especially if they're going to school and people are teasing them, it's making their life difficult, we can work on that. But we very much, even in 21-year-olds, we would discourage this use of medical aesthetics in a fashionable way. So when it comes to the fox eye or the doll lips or the, you know, we try to discourage that. We say, look, timeless elegance is something we've created to get people to understand that you can look like you over all the ages of your life and still look healthy and youthful and beautiful without looking done. The thing with using it as a fashion is the fashion will end, you know, with anything like the jackets and the hair, and the fashion always changes, and it's easy to change your handbag. But once you've done something semi-permanent to your face, it becomes an issue. We have to dissolve it. It can create more problems. You could be allergic to the stuff we use to dissolve it. And so we try to discourage that.
When asked about the do's and don'ts of cosmetic treatments and fillers, he immediately emphasized that patients should take a gradual approach and avoid supposed quick fixes.
I think that as people mature, as a society grows, as the people inside the society become more sophisticated because of an increase in studying and wealth and knowledge, there is a shift, and it happens around the world, towards looking after themselves in a better way, in a more holistic way. But again, there is this wave of indiscriminate use of these procedures until people learn and realize, and they themselves become more sophisticated in their selection of how they get their work done and what they do. It's not a case of simply taking the most filler you can get your hands on and shoving it into your face and then saying, oh, look, I look pretty. That can never work. You know, it's like taking paint and throwing it at a canvas and saying, oh, look, I've painted a face. You know, it doesn't work. It must be done with an artistic focus so that we create something that is actually beautiful. The thing with excessive use of surgeries, when it becomes a problem, and I think it's up to the doctors who should look at the patient and say, you don't need this, or you should rather be doing that. It's an ethical obligation that doctors have, and that's why it's important to actually go to have this done at a doctor, apart from the fact that it's illegal for non-medical professionals to actually inject people. I think if you could meet the people who went to a certain doctor and you could speak to them about how they looked before, what they looked like after, look at some pictures, this is something that you can use to gauge what it's like to be with that professional. You could also just look at them. You know, if you walk into a practice and the practitioner themselves looks like they have too much work done, it shows you that they're probably not very good at judging when too much is too much. So these are the things that we want you to look out for. Obviously, if you go somewhere and the price of the treatment is completely ridiculously lower than everywhere else, you have to ask yourself why. What is being injected? There has been a recent trend where we've been on our aesthetics group. I'm part of a group called AMSA. And on there were doctors posting these fake botulinum toxin treatments or unregistered botulinum treatments. There's only 2 in this country, and there's a 3rd one in the process. But you know, injecting that into somebody can be very dangerous. So on the worst case scenario, you could actually kill someone because you will suppress the muscles that they use to breathe if the dose is too high. And best case, you're basically injecting water. So it's up to patients to also understand, well, I pay a different price for the BMW and for the bicycle. Why? You know? And when it comes to aesthetics, there's a reasonable price that most people kind of charge, and then you've got someone over there charging, you know, a tenth of what they should be. And that's you know, you have to ask yourself why.
Prices for the procedures vary and are determined by a number of areas you want to be treated. South Africa is very much still affordable compared to other countries in the world.
So these treatments are affordable. If you had to look at the rest of the world, in the developed world, they probably pay about 10 times as much for the same type of treatment. So if you had to think on average, you know, $5,000 people could pay for fillers in the US with some of the best doctors. Here they probably would pay around 5,000 Rand. So it's not the same everywhere. And the thing is, we're not allowed to actually advertise prices. But you know, ballpark figures, you can see that it is much more worthwhile to do it here. And this is why we have a lot of patients who actually come here for the treatments. They'll say, look, I was coming to visit my mum, but I live in the US or Dubai or London, but I just thought, while I'm here, let me come and see you. And over time, that just becomes the norm. They start to come here to have the treatments. They like the way it looks, and it doesn't cost as much as over there.
As a result, he has trademarked the concept of timeless elegance to educate consumers on the ideal focus and outcome of aesthetic medicine.
If you are trying to select a doctor, look at their patients, try to meet their patients. Don't go simply by what you see on social media. You know, it's too easy to, even if you're not using Photoshop, it's too easy to doctor the lighting and the makeup and try to make it look really good. You have to actually see what that patient looks like in real life when their face is moving. Because also, a static image could look really good, but when they smile, you may notice where the filler is. And that means the filler has been done too superficially or with a filler that's too thick. You know, there's many different types of fillers that we can use in the skin. So it's basically a question of trying to be objective and open-minded and understanding what different doctors work with and how they work, and to get them to understand that there is a strong element of art. Our motto has been for the longest time, art meets science, because the science is in the product and we learn about it and it's not difficult, but the art side of it, to understand what beauty is, to get people to a level that they're looking attractive, you only have to make simple changes. Sometimes 1 millimeter is enough to actually cross someone over the line of attractive or unattractive. And that gets people to understand very quickly that you don't need large volumes of filler, but also how quickly you can actually go the wrong way.